What causes shoulder pain and how to fix it? Do you get stiffness or weakness in your shoulders? Are you finding it hard to carry out everyday tasks like reaching for something up high on a shelf, driving a car, or even brushing your hair? Then watch this video as I will explain the 3 most common causes of shoulder pain and how to fix it. I'm Luke Savage, CEO and Senior Osteopath at Worthing Osteopathic and Wellbeing Clinic. Bob woke up one morning to find his shoulder at the front had become inflamed and irritated. He tried doing gentle stretches on it, but it just made the pain worse. He didn't know what to do. This pain was getting him down as doing his job was just unbearably painful and he couldn't afford to keep taking time off work. Doing everyday tasks like having a shower or putting the washing out was excruciating for him. He was starting to get really fed up with the pain and quite anxious about when this would all be sorted out so that he could go back to work. Does this sound familiar? Are you suffering with shoulder pain? Then please comment shoulder below so that I know that this type of video is helpful. There are a number of causes for shoulder pain, but the most common are the rotator cuff injuries, rotator cuff tears and osteoarthritis. Number 1, the rotator cuff. The rotator cuff is a group of 4 muscles and their tendons that surround the shoulder joint and connect the shoulder blade to the upper arm. Small sacs near the joint provide lubricating fluid that decreases friction among the bones, tendons and ligaments. Rotator cuff problems occur through overuse and they include tendonitis, strains and partial or even complete tears of the tendon. When tendonitis occurs, it can become inflamed, irritated and swell. You can experience pain in the front and side of the shoulder and you may also experience some stiffness. Some activities like tennis, yoga, painting or any activity where you're using your arms overhead are possible causes of this. Often the pain gets worse with rest and improves with activity. Treatment for tendonitis is rest and ice, and after a few weeks most people recover. Number 2, rotator cuff tears. If you experience shoulder pain at night that makes it difficult to fall asleep or wakes you up, then you may have a tear in one or more of the rotator cuff tendons. Pain at night is inevitable when it comes to rotator cuff injuries. Also, you may feel some pain when lifting your arms overhead or weakness in the shoulder when trying to lift anything above shoulder level. A rotator cuff tendon can tear when falling down onto an outstretched arm, or it can happen from repeated motion, for example a plumber who frequently uses their arms overhead. The rotator cuff can also weaken with age. Treatment for a rotator cuff tear is rest, avoiding those aggravating activities along with applying ice. There are also certain exercises that can help rehabilitate the rotator cuff muscles. Number 3, osteoarthritis. This happens when the cartilage, which is the cushioning material that covers the ends of the bones, deteriorates, which leads to pain and stiffness. Osteoarthritis causes a deep ache in the back of your shoulder. As osteoarthritis worsens, stiffness in the shoulder develops and the ability to reach behind your back is reduced or even lost. Osteoarthritic symptoms can develop over time. Sometimes it's from an old shoulder injury, but for some people it's just wear and tear that happens over time. Treatment for this is similar to the rotator cuff, involving certain exercises, but for this injury applying heat is best. Suffering from stiffness and weakness in your shoulder, making it hard to carry out everyday tasks, finding it hard to sleep at night, or maybe there's a deep ache in your shoulder, then please comment shoulder below so that I know that this video has been helpful to you. Bob came into Worthing Osteopathic and Wellbeing Clinic with shoulder pain. He explained that with his job as a plumber and the fact that he played a lot of racket sports, his shoulder was very stiff and inflamed. Examining his shoulder joint allowed me to find out what the cause of the pain was and diagnose him with tendonitis of the rotator cuff. From this diagnosis, I was able to give Bob a treatment and then devise a bespoke treatment plan for him. By following my advice of rest and ice, along with specific eccentric muscle exercises and sticking to his treatment plan, Bob was able to get back to his job and racket sports within a few weeks. If you would like any more information on this topic, then please comment shoulder below and give us a like. Remember, pain is inevitable, suffering is optional. See you in the next video.